Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got a 100% on my NPTE, and this led me to found SPT with Me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our prep courses at sptwithme.com. Now for what you're actually here for, let's talk about the sympathetic nervous system. To begin talking about this subject, it's really important to know where we are coming from. So let's start at the very top and make our way down. Our nervous system has everything to do with the transmission of signals. So understanding and receiving and comprehending information along with reacting and then sending signals down. The first thing that you probably think about when you consider the nervous system is probably the concept of nerves. Those that are running down the arms, those that are running down the legs. But understand that these are not the only components. We also have our brain and our spinal cord. So we have brain, spinal cord, and peripheral, so everything else. The central nervous system, as we move down this flow chart, is consisted of the brain and the spinal cord, while the peripheral nervous system is that everything else. So think about those nerves that we were talking about, those that go throughout the arms, those that go throughout the legs. So the peripheral nervous system can be further broken up into two different systems, our autonomic nervous system as well as the somatic nervous system. Physical therapists, our favorite system is probably the somatic nervous system, given that it interacts with our voluntary actions like muscle contractions. But the autonomic nervous system deals with the opposite, involuntary actions. So think about, our heart rate and GI motility and blood pressure. These things work on their own. You cannot just sit and consciously tell your heart to contract faster and harder. You can't tell your body to digest faster. Within the autonomic nervous system, you can further divide it into the sympathetic nervous system and the parasympathetic nervous system. The parasympathetic nervous system deals with the rest and digest aspect of involuntary actions. So just to keep it simple, think about all the actions that your body does when you're sitting on the couch and you're watching TV. Now, of course, there's more to it, but at this moment, let's just keep it simple and think about it this way. The sympathetic nervous system, which is what we'll be talking about in this video, is the exact opposite. It's the fight or flight. So think about how your body would react involuntarily if there were to be a bear chasing you. Now just remember that with all of these systems, there is transmission of information to and from. So think about sensory as well as motor. Before we dive deeper into the subject, you have to understand the basics of how everything looks, especially because the image that we're using has so much going on. With the autonomic nervous system, whether you're talking about the sympathetic or parasympathetic system, understand that there are two nerves. There's a first order nerve, aka the preganglionic nerve, and this one starts in the spinal cord. Specifically, the cell body starts in the spinal cord. After this first order preganglionic nerve makes its way to a second nerve. This second nerve is also known as the postganglionic nerve. When this first nerve meets the second nerve, this forms a synapse, and when it reaches this synapse, the form of communication is like that of any other nerve. It's going to release neurotransmitters. The location of this synapse occurs at what is called a ganglion, and because it's the autonomic nervous system, it's called an autonomic ganglion. Now, a ganglion in general is a structure that has cell bodies, and it serves as a location of information transmission. And as you can see in this image, the cell body of the second nerve, which receives information from the first nerve, is exactly here. You probably heard of the dorsal root ganglion with the somatic system. It's the same idea. Then once we transmit information to the second order or postganglionic nerve, same thing, we then make our way to give information to the target organ. This is the organ that this second nerve affects, or really the whole system affects. So think about structures like our heart, our lungs, the digestive system, bladder, any and all of the organs that the autonomic nervous system affects. Now between this second nerve and its target organ, the way it communicates is also through neurotransmitters. So to summarize, there are two nerves. There's a preganglionic and postganglionic nerve. There are two synapses. There's one between the pre and postganglionic nerve, and then the other one is between the postganglionic and its target organ. Then there are also two sets of neurotransmitters within each of these synapses. These are all the things that you have to know about the sympathetic nervous system. You have to know where they originate, and in this case, it is the thoracolumbar region. You need to know where the preganglionic and postganglionic nerves synapse. Then you need to know between the two, the first and the second nerve, which one is longer versus shorter. Then lastly, it's what neurotransmitters do we use between that first nerve and second nerve, and the second nerve and the target organ. The sympathetic nervous system begins at the level of the thoracolumbar region, yes, but specifically the levels that we're talking about are every single level between T1 and L2. Now, something I want you to notice is that when you take a look at where these nerves travel, they travel to the same exact locations that the parasympathetic nervous system does. Now, of course, in this video, we are not talking about the parasympathetic nervous system. However, it should make sense to you why they go to the same regions. That's because our body is all about homeostasis. Both of these systems have to be on and off in different ratios between the two because our body needs to regulate different levels of each one depending on what it needs at that current time. Let's talk about synapse location. A majority of where the synapses occur between the first order nerve, aka the preganglionic nerve, and the second order nerve, the postganglionic nerve, is at a structure called the paravertebral ganglion, aka the sympathetic chain ganglion. The term paravertebral is very telling of where these ganglia are located, and it's right next to the vertebral column. So this is how it actually looks like. You can see these bulbous-like nerves going from superior to inferior. They're alongside the vertebral bodies. They're on both sides. The bulbous parts are what is known as the sympathetic ganglion. Where the term sympathetic chain ganglion comes in is the fact that these sympathetic ganglia, they're all connected to each other. But also remember, paravertebral ganglion is another name for this, and paravertebral meaning that it is right next to the vertebral column. It's its physical location. Here's an even more zoomed in picture of what is going on with the sympathetic chain ganglia. And this image really touches on why we have all these bulbs connected. Remember, the bulbs are the sympathetic ganglia. So let's follow the pathway. So here we see that the preganglionic nerve, the first nerve, its cell body starts at the lateral horn of the spinal cord. Then it's going to make its way out, it makes its way to the ventral root, and then it makes its way to one of the bulbs, the sympathetic ganglia. Sometimes this first nerve, aka the preganglionic nerve, it's going to travel and then it's going to synapse at the second postganglionic nerve on the same level. So when I say the same level, what I mean is that if I start at T5, I'm going to make its way to the bulb, and I'm going to synapse at the level of T5 to this second order neuron. Other times, this first nerve is going to make its way to the bulb, but it does not synapse. Instead, this first order nerve continues on and actually either makes its way up to the next ganglion or even down to the next ganglion or maybe even a few ganglion over and then synapse with the second order, aka postganglionic nerve. So for example, let's say that the preganglionic nerve is coming out of T5. It's going to make its way to the bulb of the same level. Then it can travel up to, let's say, T3 or down to T6. And at this level, then they will synapse with that postganglionic nerve. It's because of this reason of traveling up and down different levels that we need to have the chain, the sympathetic chain ganglion. Now going back to this image, this is just how the schematic looks. There's a lot of information on this picture. It's very helpful. However, it is also helpful to see closer, more detailed pictures. Like I mentioned earlier, the paravertebral ganglion, aka sympathetic chain ganglia, is where most of the synapses happen, but not all. So the remaining ones, they synapse at ganglia that are just located throughout various regions of the body. And for example, if you look at this image, you can see here that there is a superior and there's an inferior mesenteric ganglion, as well as a celiac ganglion. Now let's talk about the length of each of these nerves. So I will tell you that the preganglionic nerve is short, while the postganglionic nerve is long. Now, instead of memorizing this, let's understand it. And if anything, didn't we just talk about it? So if you think about the first nerve, cell body starts in the spinal cord, and then this tiny short nerve makes its way just next to the vertebrae, right? I mean, it's such a short distance, at least I would say. Then you consider how far this second nerve needs to travel. I mean, it makes its way all the way to its target organ. So it should make sense that this first nerve is very short, while the second nerve is much, much longer. Next, let's talk about what neurotransmitters are involved. Now, with the sympathetic system, for the first synapse, so between the pre- and postganglionic nerves, we use acetylcholine. So within the sympathetic chain ganglion or paravertebral ganglion, or the celiac ganglion, superior and inferior mesenteric ganglion, the neurotransmitter that is being sent from this first nerve to the second nerve is acetylcholine. Now, the second nerve that communicates with the organ itself requires a different neurotransmitter, and it's going to be norepinephrine and epinephrine. Now, epinephrine is actually a hormone, but let's keep it simple. The word epinephrine, it should ring a bell. It's in both of these terms. It should make you think of adrenaline. I mean, we use EpiPens to inject epinephrine to combat anaphylactic shock. So someone's going into anaphylactic shock, which closes up the airways. Well, if we pump some adrenaline and fight or flight into a person, this is going to make your body think, it's being chased by a bear. So in turn, it's going to open up our airways so that we can breathe and inhale oxygen so we can run away from said bear. So anyways, epinephrine and norepinephrine, they should make you think of adrenaline. Adrenaline is the sympathetic system. And again, the use of norepinephrine and epinephrine is done between the second nerve and the target organ. So at that location being the lungs, the digestive tract, all these organs. Here's a recap. We've talked about everything. For the sympathetic system, we are at the level of the thoracolumbar region, specifically T1 through L2. The synapse between the pre- and postganglionic nerves happen very close physically to the spinal cord. Thus, the first nerve is super short while the second nerve has to travel quite a longer distance to reach its target location, so the second one is longer. Acetylcholine is the neurotransmitter for the synapse between the pre- and postganglionic nerves, while norepinephrine and epinephrine are the neurotransmitter and hormone, respectively, that are required to stimulate between the synapse of the second nerve to the target organ. If you enjoy learning material this way, check out our NPTE prep courses at sptwithme.com. Check out this reference for more information.